Hello VNH family. Today we have the pleasure of being joined by Dr. Priya Kalyani, a renowned gynecologist with 17 years of experience and a director of Kanaa Fertility Center. We are truly privileged to have you here with us, ma'am, and we are excited to get great expert insights on women health. Thank you so much for joining us today.
Yeah, thank you and vanakkam.
We are very eager to hear your expert opinion on various topics, and we would like to have it from gynecological health to breast health. So shall we begin, ma'am?
Yes, please.
To begin with, let's dwell into some common questions that women may have about periods. So when it comes about periods, people have a question that does my mental health and stress or hormonal changes that happens affect my period cycle and things like that?
So mental health is very much related to your hormonal cycle. Period cycle it is something which is a fine-tuned cycle between your brain, one part in your brain called the hypothalamus, to another part in your brain called the pituitary gland, to your ovaries which produce certain hormones, and then that acts on your uterus to shed the monthly lining. So it is not something very simple like periods dana appdin solrade. It's a very finely synchronized hormonal cycle. So anything which is going to affect like too much of physical stress, அந்த மாசம் வந்து ரொம்ப அலைச்சல் இருந்துச்சு, out of the ordinary, or someone was sick in the family and you were put through a lot of mental stress, or you put on too much of weight suddenly, or you did some crash diet program, you just dropped weight suddenly. இந்த மாதிரி any sudden changes can affect this hormonal secretion in your brain, which in turn affects the ovaries and in turn your period cycle. So little bit of stress all of us have in today's day and age. That's not going to per se really mess up your cycle as such, but significant mental stress on a chronic level, that is on a long-term basis, can definitely mess up our menstrual cycle.
Thank you so much for answering our question, ma'am. So because we said that mental stress will have an impact on us, current lifestyle of the people have changed. Like காலையில work போயிட்டு and then we come back and they also do multitasking. இந்த மாதிரி இருக்கும்போது what kind of a lifestyle practices that should have for a healthy cycle period or something like that?
So that's again a good question and very much needed for today's day and age, I will say. இப்போ இருக்க பசங்கள்லாம் when I see them when they come up age by say around இப்போல்லாம் அந்த menstrual age ஃபஸ்ட்டு வர பீரியட் சைக்கிள் அந்த மெனார்கி அட்டென்ட் பண்ணுறதும் it has become earlier and earlier than what it was about a decade or so ago. So முன்னாடிலாம் when we used to come of age by around 13 or 14, now the average age is even as less as 11 and 12 and sometimes even 9 and 10. So anything below 8 years now, that is something abnormal, but we are all getting, girls are getting their periods early. So when they are coming by 13 or 14, pata, they're really overweight. On the age liye, they are around 50 or 60. And then by the time they hit 18 or 19, they are about 80 or 90. The time they get married and have children, I'm seeing people around 100 to 120. So all this is definitely going to have a toll on their reproductive health and their hormonal health also. So yes, weight gain too soon, too fast can definitely have an impact on our period cycle. Regular vara periods, irregular ஆகும். Weight ன்னு சொல்லும் போது again so much of unhealthy eating habits, junk food, processed food, no one has time to cook anymore-ங்கிற மாதிரி வீட்டுக்கு வந்தோடனே ஈஸியாக வந்து டெலிவரி ஆர்டர் பண்ணிக்கலாம், ஸ்விக்கி பண்ணிக்கலாம்னு சொல்கிறது, lack of physical activity, everyone is in IT field or any sitting job, all the time they're sitting at a desk, there's no physical activity and so many gadgets, everything is competing for not making us move from our seats. So we don't even walk anywhere. Everything is delivered to our houses. So physical activity, exercise definitely plays a role as such in your weight and ultimately your period cycle. Sleep is an underrated lifestyle habit. So everyone's on the phone binge watching Netflix or just doom scrolling, and then you're just going to compromise on your sleep. And good quality sleep, especially circadian rhythm, hormonal cycleங்கிறது அது ஒரு fine tune cycleன்னு சொன்னேன், அது ஒரு rhythm பிரகாரம் நடக்குது. So going to bed at 10 p.m. and getting up at 6 a.m. is the best because that's how we have evolved over so many thousands of years. நம்ம பாடி அப்படி தான் எவால்வ் ஆயிருக்கு. இப்போ with electricity and so many gadgets and everything, if sleep is being under compromised, definitely that can have an effect. And the fourth thing which we talked about already was stress levels. So put together, lifestyle is made up of so many things. It's your diet, it's your exercise, your stress levels, your lack of sleep, as well as substance abuse solvo, which is one the alcohol and smoking, which is also on the rise nowadays. So all this put together can definitely impact our hormonal cycle and hence our periods too.
Got it. So if they have to improve their lifestyle, then they have to focus on all of
the factors and not just one. It's not as if I eat fruits and vegetables for 2 months, I will lose some weight, and then again it doesn't make sense. Or going on these new fad diets, so paleo, keto, see, and sometimes they go for these replacement shakes. They do lose some weight, but the minute you stop doing it, you're just going to regain all that weight back in 1 month's time, which is not going to be useful at all. So any diet order which is something healthy eating habits which are sustainable long term, அதுதான் லைஃப் லாங் நம்ம எதை ஃபாலோ பண்ணுவோமோ சில ஹெல்த்தி ப்ராக்டிசஸ், that's what we have to follow. So looking at diet alone as a short term route to just weight loss and then I can do whatever I want is not going to work.
Yeah, from here I'm going to take that circadian rhythm to be followed for myself right now. Thank you so much, ma'am. And is there any treatment or a lifestyle change that somebody has to do for them to help understand about the menopause symptoms that they're going to have, or how do they know about it?
So menopause is the other end of the spectrum. We were talking about menarche or first start of periods. Menopause is when our periods are actually going to stop. So what is the average age of menopause? It is about 50 to 52 usually. And sometimes if menopause is earlier in families, we see it in our Indian scenario, sometimes 45 and above itself, they start getting into that transition phase. So when your periods have stopped completely for a period of 12 months or a year, then it is considered as menopause. In the build-up and the time period, in the transition phase, your periods may start becoming a little erratic, ரொம்ப irregular-ஆக வரலாம், தள்ளி வந்து நிற்கலாம். Suddenly, sometimes சில பேருக்கு ஸ்டாப் ஆகிடலாம். All of a sudden, just they were getting regular periods and then it stops suddenly. Or the quantity of flow reduce ஆகி stop ஆகலாம். So all these changes in their period cycle வரும். After menopause, சில பேர் நினைக்கலாம், especially if they've been suffering with their periods, that it's okay, so fine, that I'm done with my cycle. But estrogen hormone, which is secreted by your ovaries, is important not only for you to get your periods, but it has a lot of beneficial effects in the women as such, starting from our brain health, our heart health, our bone health, bone stronger irukradhukku, so many, as well as long-term health effects. We'll have to look at bone health, your cardiac health, brain function, cognitive, idellame. So there are a lot of things to talk about in menopause, but common women face pandra problems idudha.
Thank you so much, ma'am. I would say after periods, there is a subject that people don't talk, which is vaginal health. So in vaginal health, what is that people in general have to understand about vaginal health is something that I would like to understand from you.
There is no specific hygienic measure or different things you have to put inside or clean inside per se, because vagina also has healthy bacteria living in it. So vaginal microbiome adu vandittu, which is good, it keeps us free from infections. And vagina also has an acidic pH. So acidic pH that itself is a protection against microorganisms causing infections as such. So when you go and put things inside it in the notion that you have to clean it, that is when we change the pH of the vagina, and that can predispose us to getting more infections. So internally, you don't clean pannon avasiyam illa unless we have an active vaginal infection which has been diagnosed by a gynecologist. For all the hygiene is like outside, where you have your mons pubis and the hair irukra area. So keeping the hair vandittu ellarkum hair remove pannuma appdin solliட்டு இருக்கணும். So that is absolutely your vision, solve. Keeping it trimmed if you want, instead of completely shaving it or removing it, is also going to be more than sufficient. So changing your panties, wearing cotton panties, and if you're really having a lot of discharge or something, or if you're on your period, making sure you're changing your sanitary napkins regularly every 4 to 6 hours once it gets soaked, and just cleaning the vulva externally with normal water or soap or whatever body wash you're using is going to be fine. Do not put anything inside the vagina. Specific feminine washes as such are not really required, especially ones with fragrance. Fragrance in vandali, it's going to be containing chemicals as such, and that can cause irritation, so it is better to avoid them. If you must use a wash, use one which has a acidic pH, which is less than the normal pH, less than 5, so 4.5 or something, which is always better. But other definitely use pannadam, we are going to keep it clean.
You've almost answered a lot of questions of mine, ma'am. Just one thing that I want to understand is, aside from regular checkups that we do, what are the preventive measures that we should consider for our gynecological health?
So an annual gynecological review is what I advise usually. So gynecologist yearly once poi paranga, whether your bowel habits are normal, you're able to pass urine normally, or there's any leakage which can happen with women. All this can be discussed along with your gynecologist to that.
That's definitely helpful for all our people. So as VNH Naiduhall believes in giving good information to our customers, we conduct something called BraTalk. This is a bra awareness program, because we also tell customer that you need to know that your bra sizes changes based on your hormonal changes. So we educate them on that. So the next topic that we want to get your expert insight is based on the bra and the breast health that we have. How often someone has to perform the self-examination?
Yeah. So you could start doing it probably once in 3 to 6 months once, and then at least konja age aga once in 3 months or so. When is the best time to get it done? Best time is probably in the week after your periods, when the breasts feel a little looser and not very tense. It's not going to be painful. Periods varadhukku minnadi varam, it will be heavy, it will be a little tender to touch. So periods vanda modal vaarathila nammale examine panni paakalaamngradha, and that is a simple, most important thing which you can do to ensuring everything is okay. Even recently we saw in a report that a popular actress had been diagnosed with stage 3 breast cancer. So breast cancer is a completely treatable cancer in today's day and age if it is discovered at a younger age. And there are so many breast saving procedures and so much of advances in that field as such. But நம்ம இந்த மாதிரி ஈஸியாக கண்டுபிடிக்கிற கூடிய ஒரு கேன்சரை ரொம்ப வந்துட்டு வளர விட்டுட்டு அட் அ லேட் ஸ்டேஜ் கண்டுபிடிக்கும் போது தான் ட்ரீட்மெண்ட் பிகம்ஸ் வெரி டிஃபிகல்ட் அண்ட் த ப்ரோக்னோசிஸ் இஸ் நாட் ஸோ குட். ஸோ அ சிம்பிள் breast examination by yourself, and if you have any doubt, approaching the doctor sooner rather than later. சில பேர் நம்ம ஊரில் பயந்துக்கிட்டே டாக்டர் கிட்ட போனால் டெஸ்ட் எடுத்தால் ஏதாவது பிரச்சனையாக சொல்லிடுவாங்களோன்ட்டுன்னு. I would say it's always better you know something is wrong with you sooner rather than later, so that at least there is a treatment for it.
Thank you so much, ma'am. Right now we hear a lot of food that is going to help you kind of thing. So is there any preventive measures or lifestyle changes that can also help reduce these breast cancers that we hear right now?
Breast cancer reduction-க்கும் ஃபுட்டுக்கும் பெரிய சம்பந்தம் கிடையாதுன்னு சொல்வேன். It has a lot to do with genetics more than anything as such. And as any cancer can grow in any part of your body, the cells turn on themselves and start growing அப்படிதான். So preventive health-ன்னு இல்லை, for your good health, it is always better that you consume a lot of fruits and vegetables primarily. So fiber increase பண்ணுங்கிறது முக்கியம். ஃபைபர் இன்க்ரீஸ் பண்ணும்போது டயட்டில் த்ரூ ஹோல் கிரெயின்ஸ், பை ஃப்ரூட்ஸ் ரேதர் தென் ஜூஸஸ் அண்ட் வெஜிடபிள் இன்டேக் இன்க்ரீஸ் பண்ணும்போது நம்மளுக்கு கட் ஹெல்த் நல்லாயிருக்கும். கட் ஹெல்த்தில் வந்துட்டு நம்ம மைக்ரோப்ஸ் ஃபைபர் ஈஸ்ட்ரஜன் கண்டெய்னிங் அந்த ஃபுட்ஸை கொஞ்சம் வாட் டு சே தே வில் அப்சார்ப் இட் பெட்டர் அஸ் சச். ஸோ ஈஸ்ட்ரஜன் கண்டென்ட் உடம்புல குறையும் போது நம்மளுக்கு இந்த மாதிரி breast cancer issues எல்லாம் குறையும். ஸோ ஃபார் யோர் குட் ஹெல்த், ஃபார் யோர் gut health, for preventive health, increasing your fiber intake is very important. And fiber is present only in plant foods and it is completely absent in animal foods. So non-vegetarian சாப்பிடக்கூடாதா? சாப்பிடலாம் of course, but again not on an everyday basis, and always include more vegetables along with it in solvay. So once or twice in a week is fine. Avoiding sugar, high processed junk food, கடையில் கிடைக்கிறது, பேக்கெட்டில் விற்கிறது, ஆல் கெமிக்கல்ஸ் அடிட்டிவ்ஸ் யூஸ் பண்ணுறது, இதெல்லாம் அவாய்ட் பண்ணிக்கணுங்கிறது முக்கியம்.
Thank you, ma'am. Importance of innerwear care for a healthy life. What would be your thought on that?
Innerwear is very important because it is what is present next to our skin and it is in direct contact with our skin. அதனால தான் நம்ம clothes வருது அப்படிங்கிறதுனால. So wearing light breathable fabrics, especially in hot climates like ours, is always better. Yes, lingerie comes in all sort of fancy shapes and materials and silks and satins as such. But for our climate, it is on a regular basis, probably cottons and any synthetics avoid பண்ணிக்கணுங்கிறது பெட்டர்ன்னு நினைப்பேன். Even in your panties as well as your brassiere as such.
Thank you, ma'am. How important a proper size and fit of bra for breast health?
So proper size and breast health order, proper size and fit are designed are primarily more important from the point of view of comfort as such and providing good support to your breast as such. So ஒழுங்கா இல்லை ஃபிட்டுன்னா it's going to be chafing against your skin and it can cause a little bit of irritation and then breast under sweating நிறைய இருந்துச்சுன்னா it can cause a little bit of more fungal infections and things like that. So breast health ஓட support பண்றதுக்கு which is the primary aim of your brassiere, that's why you're wearing the brassiere. So proper fit இருந்தால் தான் அந்த proper support and comfort இருக்கணும். So that should be ensuredங்கிறது முக்கியம்.
Yeah, there are a couple of people who have good fit, but they also face some skin irritation every time when they wear innerwear or a lingerie. So what do we suggest for such people?
So maybe they're sweating more often or if their breasts are very big and வந்துட்டு ரொம்ப கொஞ்சம் sag ஆகுதுன்னா அந்த under surface of the breastல வந்துட்டு lot of sweat collect ஆகும்போது அவங்களுக்கு அந்த மாதிரி friction வரதுக்கான chances இருக்குது. So making sure that their complete support வந்து sides-லையும் provide ஆகிறது. There is separation of the breast so that in between the breasts அவங்களுக்கு sweating and irritation by one rubbing against the other இல்லை அந்த மாதிரி ஸ்டைல் அவங்களுக்கு ப்ரொவைட் பண்ணுறது. மேக்கிங் ஷுர் இட்ஸ் நாட் வெரி டைட் அட் த ஸ்ட்ராப் ஆர் அட் த பேக் ஸோ விச் இஸ் கட்டிங் இன் டு their skin which can also cause irritation. இதெல்லாம் ப்ரைமரி ஒழுங்காக இருக்கா, they may think that the fit is fine but இதெல்லாம் கரெக்டாக இருக்கான்னு பார்த்துக்கலாம். And if they are sweating a lot, especially in our summers and things like that, they can change their brassiere and make sure that they are taking a bath twice a day as such. And the undersurface life, if they are prone to getting fungal infections, especially in the hot weather, they can just use absorbent powders or வந்து இந்த மாதிரி antifungal powders on their doctor's advice if required.
Thank you so much, ma'am. How often should people replace the bras for optimal breast health and comfort? Women, they don't change their bras most often, so we wanted to understand from you that.
Yeah, that depends on how long it is supporting you. So fabricங்கிறது with time the elasticity is going to change. Your body shape, as you said, may change across your reproductive life and as you age also it may change. So just get it assessed once in 6 months to a year at least and don't keep using something forever even if it has really lost its fit, even if it has become very loose and saggy. And madri irukkunna, of course it is better to get it changed and assess your size also if you feel that the fit has suddenly become tighter or looser as you go up and down on your weighing scale or even as you age your breast shape and the support is going to change as such. So just get it reassessed when you think that things are not right and probably changing a brassiere once in 6 months or if you're using it every day, definitely once in 6 months or probably if it is just occasional use bras and you're not using it every day, probably a yearly once would be better.
Thank you, ma'am. So is there any specific bra that people have to use when they do sports activity? Because right now sports bra is a term that people are moving into when they choose certain sports bras, right? So is it mandatory that they have to choose?
It's not mandatory, but it's going to be more comfortable, I would say. So any bra which is designed to fit and look seamless under the t-shirt, which is again what most people wear when they are going to be working out, and anything wherever they have high impact activities in the bouncing of the breast irukkakoodadhu, so proper fit and support adu vandu provide pannichina, then it will be better. So if that's a sports bra, then a sports bra is going to be more comfortable, but any fit which they feel is going to really prevent that bouncing and when the movement of the breast, then that would be fine.
Yeah, because you're so right, because in bras we have multiple impacts, high impact, medium, low. So based on the activity, they can definitely choose the impact of the bras. When should a teenager girl start wearing a bra?
Whenever she feels that she has to is what I would say, because breast size over a teenager it's difficult to fix a certain age as such. There are some girls who come to us just because the mother feels that the breast size is very huge for her age and she's feeling very uncomfortable because she's being noticed for it even from the age of 12 or 13. And there are some who are going to be really flat and they don't really need to wear a bra, but just because all the other girls in their class are wearing it, they would want to wear one. So it is really dependent on the breast size and how they feel And if it is going to be a little more at a certain age and they feel uncomfortable going without a brassiere because again it is being visible under their clothes, that is when they would start needing to think about using a bra.
So in this case, we say that mothers think the comfort of the teenager and ask for her comfort and
Yes.
make the choice. Yeah, thank you, ma'am. Can wearing a bra impact breast development in younger individuals?
Can wearing a bra decrease the growth of your breasts in any manner? No. Breasts are primarily made up of pad tissue which is resting on a bed of muscle, and it is supported by ligaments which are running through it and attaching it to your pectoralis muscles, which is the bed. So wearing a bra is just going to provide support. It is not going to help or decrease your breast growth in any manner.
And we tell new moms to wear bras during breastfeeding. What type of bras are recommended during pregnancy and breastfeeding?
So during pregnancy, typically the size of the brassiere, your size of your breasts are going to increase. And this is going to increase across the trimester, starting even from the first. It's going to feel more fuller. They are going to feel more sensitive. The nipples are going to be painful. So all this is because of excess hormone estrogen, which is going to be secreted in the pregnancy. So as your size changes, it even changes a size or two. As it changes, you should reassess your fit and make sure you're also increasing the size of your brassiere. If you try and wear the same brassiere throughout your pregnancy, it's going to be highly uncomfortable because it will start getting very tight as such. So make sure it's fitting well. And after delivery, most of them prefer to use a feeding bra for ease of comfort. If they want to use the same bra, yes, again they can do so, but it is just that each time it has to be unhooked or it may be difficult to get the breast out in a hurry for breastfeeding. So using a feeding brassiere would be more comfortable for them.
So what tip do you have for choosing the right bra at different stages, like during puberty, pregnancy and menopause? And why do you think that's important?
Because we don't stay the same size all through our lifespan, I say. So our size changes, our weight changes, our body shape changes, and likewise the size and shape of your breasts also changes. So you have to find, and it depends at each stage how active you are, what activity are you using the brassiere for, what dress are you going to use the bra under. So all that, as it changes, your needs will change, and likewise your fit will change. You should go and get it checked out in the store. And I know your Naiduhall is a very, very old store as far as we are concerned. So right from the beginning, that used to be the only store initially, I think, when we were all young, to just go and get our innerwear. Though now the many other options are available online also. So just going somewhere and having them actually measure you and getting the correct fit would always be better rather than trying to figure out things yourself.
Thank you so much. And we always have our experts wherein we tell our customers that it is important for them to check themselves. We don't know how often our body goes through a change. And you perfectly said, with all the inputs, definitely taken that you need to check through all your stages of life. Thank you so much, ma'am, for your valuable time. And this whole session has really added value for us, because if you see that people need a reminder, because they might hear this all the time, but a reminder from a very renowned person like you who had been in the field for 17 years. I also felt like you need to sleep. Listen, right now you have heard from ma'am herself. So that was very valuable. And in this BraTalk, we are very happy that you are also part of us. And as you said, this is going to make an impact in our customers' life. Thank you
so much for inviting me to be part.
Pleasure, and we would like to see you there as well.
Sure.
Thank you so much.
Thank you.